Ever wondered why leukemia and lymphoma, both cancers of white blood cells, cause such different symptoms? The answer lies in where they start their attack on the body. Understanding this difference is key to early diagnosis and can genuinely save lives. Let's break it down. Leukemia is a cancer of the blood and bone marrow. It all begins when a genetic mutation happens in a very early blood cell, a hematopoietic stem cell. Think of these as the parent cells for all your blood cells, red cells, white cells, and platelets. This mutation causes an abnormal white blood cell to go rogue. It starts multiplying uncontrollably, creating a massive army of dysfunctional cells. These malignant cells then take over the bone marrow, the very factory where your blood is made. Lymphoma, on the other hand, starts in the lymphatic system, specifically in the lymph nodes and lymphoid organs like the spleen. These are the body's filters, crucial parts of your immune defense network. So, while both are white blood cell cancers, leukemia is a liquid tumor of the blood-forming tissue, and lymphoma is a solid tumor starting in immune glands. This fundamental difference in origin explains everything about their symptoms. Let's look at leukemia first. Because it starts in the bone marrow, it disrupts blood production right from the beginning. The cancerous white blood cells crowd out everything else. What happens next? First, red blood cell production plummets. This leads to anemia, making patients feel extremely tired, weak, and breathless. It's a fatigue that doesn't get better with rest. Next, while the white blood cell count might actually be high, these cells are immature and useless. They can't fight off germs. This leaves the body's immune system incredibly weak, leading to frequent and persistent infections. A cold might turn into pneumonia, or a small cut might get dangerously infected. Then there's the issue of platelets, the tiny cells that help your blood clot. With no space to grow, platelet counts drop dramatically. This causes easy bruising, frequent nosebleeds, bleeding gums when brushing your teeth, and tiny red or purple spots on the skin called petechiae. Even bone pain can occur, especially in children, because the overcrowded bone marrow literally stretches the bone from the inside out. Finally, systemic symptoms like fevers, night sweats, and unexplained weight loss are common. These are caused by inflammatory substances called cytokines, released by the cancer cells and the body's constant but failing immune response. With leukemia, symptoms often appear quickly and intensely because the blood itself is compromised from day one. Now, let's shift to lymphoma. It begins quietly inside a lymph node. The first sign is often a painless, swollen lump, typically in the neck, armpit, or groin. Cancerous lymphocytes multiply within the node, causing it to gradually swell. Because it's usually painless, it can be easy to ignore at first. As these lymph nodes get bigger, they can start pressing on nearby organs. For example, enlarged nodes in the chest might press on the windpipe, causing a persistent cough or shortness of breath. If they grow in the abdomen, they can cause a feeling of fullness or abdominal pain. Just like in leukemia, lymphoma can also cause what are known as B symptoms: fevers, drenching night sweats, and significant weight loss, all driven by those inflammatory cytokines. Crucially, in the early stages of lymphoma, the bone marrow is usually unaffected. This means blood counts often remain normal. Anemia and frequent infections typically only appear much later in the disease if the lymphoma spreads and infiltrates the bone marrow. This is why lymphoma can be a much slower, sneakier disease. It starts locally and then spreads through the lymphatic system. There are also differences in who gets these diseases and how they're treated. Leukemia is more common in children and older adults, and its onset is often rapid. Lymphoma is more frequently seen in adolescents and young adults, with a slower, more gradual progression. Thank you for watching, and don't forget to follow for more health insights.